I am Jenna Carr, and I'm currently a COTA at Carolina Therapy Solutions for Kids in Rock Hill. And I work hands-on with all of our pediatric clients. Some of them are seen in the office, and then some of them are seen in a home setting.
Awesome. So what made you decide to go into occupational therapy?
Yeah, so I had a brother. He was younger than me, and he was had OT and PT. And when I was kind of figuring out what I wanted to do with my life, my mom kind of sat me down, and we talked a lot about the medical field because you can really kind of go a number of different routes. And my parents are both nurses, and I've heard too many horror stories to be a nurse, so kind of took the OT route just because the impact that the OT made on my family and my brother, I thought that was just a really unique thing to bring to a profession. You know, not a lot of jobs you can affect your client and the family. So I just really wanted to kind of have that like holistic view on the entire family as opposed to just one in particular person.
What is the difference between occupational therapy and physical therapy?
Yeah, so there's a lot of overlap between OTs and PTs. PTs are typically more so like gross motor in the sense of running, jumping, coordination type things. Whereas OT can do that, we just look at more of a functional day-to-day aspect. So if somebody had a stroke, for example, and they can't brush their teeth, we would kind of look at different ways we could help them relearn how to brush their teeth. So we really focus on all of the things that you do from the time you wake up until the time you go to bed. If you have any problems with any of those, we kind of swoop in and really work on getting you back to
The preparation look like in order to become an occupational therapy assistant?
Yeah, so I took a little bit of a longer route. You can go right out of high school and do a 2-year program at an OTA program. I went to South University in Columbia. I decided to take a longer route, and I went to Winthrop and got a bachelor's in exercise science. And then I used those prerequisites and that experience to go to an OTA program.
Okay. And now if you wanted to become a registered occupational therapist, what would that look like now?
Yeah, so an OTA that wants to take the route of going to becoming an OTR, you have to work for a minimum of 1 year, and then they do have bridge programs. So one of the ones off the top of my head is CPCC. And so that's a shortened amount of time because you already have a baseline of skills. So you just take those skills you know as an OTA and apply them to a master's program in a bridge program for OTR.
And would that take about 2 more years?
I think it is 2 years, yeah.
Okay.
And then you also have the option of doing a doctorate through that too, kind of going all the way to the end.
Awesome.
Can you explain the differences between the occupational therapy assistant and an occupational therapist?
Yeah. So an occupational therapy assistant does more of the like hands-on. Actually, let me backtrack. So the OTR comes in and does the evaluation for all of our kids, and that kind of looks like sitting down, doing a couple of different standardized tests with them, and then looking at if they even qualify to get OT services, and then if they do, writing up an evaluation and a plan of care. The OTA would come in and follow that plan of care, and typically I would say it's between 5 to 7 goals for me, and I can kind of go at those at however I want to, but as long as I reach that end goal of what the OTR has put into place, I then come in and do all of my sessions based on those goals that the OTR has put in place. That seemed kind of wordy, but
Excellent.
Oh, that makes sense.
okay.
So basically, the registered occupational therapist creates the plan, and you execute the plan.
Exactly. And then we are in communication throughout the entire plan of care. So if there's any tweaks that need to be made or anything that I'm like, I don't think we're going to meet this goal, or hey, we've already met this goal within a week's time frame, the OTR will come back in. Typically, it looks like every 8th visit, the OTR will come in and do a progress note to kind of see where the kiddo's at, any tweaks we need to make, and then even, that could look like a discharge as well. And so we're in communication throughout the entire time that the kid's on our caseload. And then if it's a discharge situation, then the OTR will come back in and do the discharge.
Okay. So about how many kids do you see in a given day?
Yeah. In a day, it varies. With our clinic, it's a little bit different. We see some kids, like I said, in the clinic and some in the home, so you kind of factor in that driving time in between. But a typical day is anywhere from 4 to 6 kids per day.
So can you kind of explain what like a day looks like for you, any given day?
Okay, yeah, that's hard. I think each day is really different. Typically the night before, I'll look at my schedule and come up with, what do I want to do in each session. And I have little sticky notes on my computer to kind of follow along throughout the day. But yeah, just following my schedule that's been pre-planned, figuring out exactly what I want to accomplish during that session based on their goals, and then executing that.
Awesome.
In what settings can occupational therapy be done?
Yeah. I mean, I feel like the possibilities are really endless. I think the very cookie cutter, if you will, is there's pediatrics, skilled nursing, hospitals. You can go into a hand clinic. There's also, you can kind of take the hippotherapy route, which is a horse-based therapy. But I think ultimately, you kind of have a lot of flexibility because you are working with your everyday activities. So if anybody has any problems with that, I know South Carolina, I think in Columbia, they even have an OT running the driving course, and kind of retraining people how to, get back on the road safely, things like that. So yeah, the possibilities are really endless.
Is it done in the school systems too?
Yes, the school systems, yep. And I know a couple of therapists that actually can be in surgeries. So I think that's typically seen in hand clinics to really observe what the doctor or the surgeon is doing and what muscles and tendons they're really working on, which is kind of cool. I didn't realize that until actually my mom told me about that. So yeah, the possibilities are really endless. Yeah.
So about how much money does an occupational therapy assistant make across those settings?
Yeah, so in a typical pediatric setting, especially in this area, you're looking at more of an hourly based salary, and that is going to be per session. So if you see a kid, you get paid for the session. If for whatever reason they cancel or reschedule, because you're here, you don't necessarily get paid. But that can range anywhere from, I'd say, $25 an hour to $35 an hour based on experience, certifications, things like that. Would you say that's accurate?
Mm-hmm.
Yeah. That's great.
Now, in hospital settings and things like that, those are typically salaried
Okay.
positions. So,
That's okay.
But that's a good thing to know, because if they're looking for something that's a more, consistent, right? Yeah. So a salary position, the hourly pay would be closer to the $16 to $18 an hour, but then they can look at 40 hours a week and expect to, and then they'll, you also get benefits and things like that.
Mm-hmm.
But it's just a little more systematic. I guess the approach is a little more systematic, and you're dealing with a lot of you'll deal with a lot of stroke patients and traumatic brain injuries and things like that. Just short-term rehab to get them back out into the community. So, which is a lot of fun too.
Awesome. Do you have any other questions you want to ask her?
What would you say is the best thing about your job?
Yeah, I think I think in pediatrics it's hard because you don't see success overnight by any means. But I think the feeling of you've been working on this one thing for 2 months, and then one day they come in and they can do it. It is the most rewarding thing, especially when you catch it on camera, because then you can watch it over and over again, and just really see the impact that you have on these kids, but also on the families, which is just, I think you can't put an amount on that. It's just amazing.
That's awesome.
Oh, I'm getting emotional over here. That's so cute.
I love that.
Are they hiring a lot of occupational therapy assistants and occupational therapists in this
area?
In this area?
Mm-hmm. That's a tough question, just because of COVID right now. I think I think the job market in general is just a little bit trickier. I think if you set yourself up to be competitive, I think that's a great way to kind of go into the job search. I do know that in the skilled nursing area, they've gone through Medicare changes. So that's, I know when I came out of school, it looked a little bit different just because they were kind of figuring that out. But I do think there's a lot of opportunities for occupational therapists in this area, most definitely.
That was a great point that you made, though, about making yourself competitive, because you remember I was not looking to hire anyone. And I was planning to reach out to Jenna and let her know that I was not looking to hire. She sent me her resume and everything via email, but then when I looked at it and I read her story, you know, she added a little something extra to her resume, and that really helped me to get to know kind of who she was. And I was like, I've got to beat her. You know, she came in and she had a lot of other experiences too. She didn't have experience as an OTA, but she had, you know, just gone the extra mile just to kind of get some experiences. Were you shadowing? And I mean, she'd done some shadowing experiences and worked in other areas in the field, which was great.
I think the biggest thing to just make yourself competitive, and I think too, making sure, like when I first got into this, I mean, how do you know that this is what you want to do until you experience it firsthand? So I spent a lot of time in skilled nursing facilities. I did shadow a little bit in the school system. Winthrop has a really great internship program, so I was able to do a whole semester of an internship at a clinic that had speech, PT, and OT. So I think just kind of reaching out to local communities and seeing if shadowing or observing or doing some sort of an internship is even possible. I think that's just a great way to kind of get your foot in the door. The therapy world is so small, which is crazy to believe, but I think, you know, ultimately it's who you know along with what you know, that'll really just kind of like catapult you in the right direction. So
yeah,
that's
and in
very
pediatrics is very relationship based. A lot of the clinics in this area, if you come out of OT or COTA school and decide that you want to do pediatrics around here, it's imperative almost that you go and do some shadowing hours, because it's an independent owner for the most part who, you know, typically they'll go out and they'll look for someone to hire. They're going to ask around. They'll ask other people that have, you know, might have worked with you in the past and things like that. So it's very relationship based. They take referrals from other people that they know and trust, and not typically kind of just pull off of Indeed and hope for the best kind of thing. So you want to make sure that you have a great resume, but you also want to make sure that you have great interpersonal skills and things like that. Because when you come in, that person needs to immediately relate to you. Because this is a relationship based field, very much so.
definitely.
Great.